Vanakkam, good morning. In this video, we are going to discuss about the renal circulation. This diagram depicts the renal circulation. So, renal artery is arise from the abdominal aorta. It is enter into the kidney. So, it is form the interlobular artery and arcuate artery, and interlobar artery gives the afferent arteriole, glomerular capillary, efferent arteriole, train into the efferent arteriole, and interlobar vein, arcuate vein, and interlobular vein train into the renal vein. So in this diagram, single papilla of the kidney is enlarged. This is the cortex. Interlobular arteries arise from the renal artery. It gives the arcuate artery, and interlobar artery. It gives the afferent arteriole, glomerulus efferent arteriole. It forms a peritubular capillary plexus in the cortical nephron, vasa recta in the medullary nephron. Then it forms a interlobar vein, arcuate vein, interlobular vein, renal vein. This diagram also depicts the renal circulation from the aorta interlobar artery. It forms arcuate artery. It gives the interlobular artery. It forms the afferent arteriole, train into the glomeruli and efferent arteriole. So in the cortical nephron, it forms the peritubular capillary plexus. In the medullary nephron, it is forms the vasa recta. Then it forms the interlobular vein, arcuate vein, interlobar vein, train into the renal vein. In this slide, the renal circulation explained in the form of flow charts. Renal artery gives the interlobar artery. Interlobar artery gives the arcuate artery. Arcuate artery gives the branch of the interlobular artery. Interlobular artery gives the thick walled short afferent arteriole. It forms a tough top capillary network in the Bowman's capsule, that is glomerular capillary. It is glomerular capillary train into the small efferent arteriole. Only in the kidney, the capillary networks train into the arteriole, efferent arteriole. So all the capillary network train into the venule. Here only it is train into the efferent arteriole. So the efferent arteriole in the cortical nephron, it forms the peritubular capillary networks. In the medullary nephron, it forms the vasa recta. Then it forms the segmental vein, interlobular vein, and arcuate vein, interlobar vein, and renal vein. This is the flow chart of the renal circulation. The peculiar features of the renal circulations are only in the renal circulation capillary train into the arteriole. Usually capillaries train into the venule. The renal circulation only capillary afferent arteriole train into the capillary train into the efferent arteriole. So in the efferent arteriole break into the numerous capillaries, it supplies the different nephron. It is also occur in the renal circulation. The total surface area of the renal capillaries is equal to the total surface area of the renal tubule, that is 12 meters square. Another important features of the renal circulation is renal blood flow is comparatively higher than other organ blood flow. It is 300 to 400 ml per 100 gram per minute, or 1200 to 1300 ml per minute. Comparatively, coronary blood flow is less 60 to 80 ml per 100 gram per minute. Brain blood flow is 55 ml per 100 gram per minute. Skeletal muscle blood flow is 3 to 4 ml per 100 gram per minute. Next important features of the renal circulation is renal cortical blood flow is higher than renal medullary blood flow. The renal cortical blood flow is 5 ml per gram per minute. Renal medullary blood flow is 0.5 ml per gram per minute. The next important feature of the renal circulation is that it has the less arteriovenous oxygen difference compared to the coronary circulation, cerebral circulation, and whole body circulation. So venous blood contain the high oxygen content compared to the other circulations. So the AV arteriovenous oxygen difference is only 1.5 ml per deciliter. The oxygen consumption of the kidney is 6 ml per 100 gram per minute. The maximum oxygen consumption of the kidney is 6 ml per 100 gram tissue per minute or 80 ml per minute. Pressure in the glomerular capillary is very high, 45 millimeter mercury. The peritubular capillary is 8 millimeter mercury. The renal vein it is only 4 millimeter mercury. So this is important for the glomerular filtration and renal blood flow. The renal blood flow is measured by the Fick principle by using the indicator para-amino cupric acids. First, the effective renal plasma fraction is calculated by this formula: urinary pH concentration, plasma pH concentration, and volume of the urine. Urinary pH 12.4, here 0.02 into 1, it is 620 ml per minute. Actual renal plasma flow is effective renal plasma fraction and extraction ratio. Extraction ratio is 0.9, so it is 690 ml per minute. Renal blood flow is measured by the renal plasma flow in multiplied by the 1 divided by the 1 minus hematocrit. So 690 into 1 divided by the 1 minus 0.047 equal to 1300 ml per minute. This is the method of measuring the renal blood flow by para-amino cupric acids as an indicator. Thank you for watching this video. If you like this video, press the like button and share your friends. Those who are not subscribed this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbooks. Thank you once again.